Years of conflict has caused damage to the mental health of Yemenis, especially at the time of the war and especially to children and women. Atrocities of such a bloody war have made thousands of people suffer from traumas which could last for their lifetime. This report has more details.
Yemen's 7 years of brutal civil war have caused an explosion of mental illness, overwhelming the basic healthcare services. Depression, post-traumatic stress disorder, and psychosis are some mental diseases that many Yemenis are suffering from. According to Health Ministry figures, the war-torn country, with around 30 million people, had just 59 psychiatrists in 2020, which means one for every 500,000 people. Add in therapists, caregivers, and nurses, and the number of professionals dedicated to mental health rises to 300 divided across 7 hospitals. Director of a psychiatric hospital in the rebel-blockaded city of Taiz stated that they are trying to provide treatment, but they cannot treat everyone. Taiz is one of the places hardest hit by the conflict. While the Taiz Psychiatric Hospital has space for 200 patients, the numbers needing care because of the tragedies caused by the war have surged far higher. The hospital lacks the necessary staff and drugs to cope. As government funds cover just a quarter of its budget, it relies on donations for the rest. The authorities have not published any recent data on mental illness in Yemen, along the Arab Peninsula's poorest country. In 2017, a study was conducted by Yemen's Family Development and Guidance Foundation, based in the rebel-held capital Sana'a, estimated that nearly a fifth of all residents had mental health issues. The report said the population faces constant pressure, loss, and serious shocks, whether as a result of food insecurity, unemployment, cholera, arbitrary detention, torture, indiscriminate attacks, airstrikes, or poor basic public services. The United Nations, in a report this year, said the number could now be even higher because of the additional strain of the COVID pandemic and the continuing toll of the conflict.